A lot of times, particularly with adolescents and young adults, even older adults who have careers, people don't want to enter treatment because they think it's going to set them back school-wise, set them back career-wise, particularly for people who are in high school or in college. And I oftentimes share with people, depending on what level of care and what level of help you need, again, the earlier the better, you'll be able to, for a lot of cases, you'll be able to continue to take classes and do some schoolwork. And even if you can't, it would be similar to needing a heart surgery, right? People generally don't say, if somebody goes to a pediatrician, the pediatrician says to that 16-year-old and their parent, you have a patent foramen ovale, I think it's causing your shortness of breath, and we need to surgically repair that. It's going to mean you're going to be out of school for 2 weeks. We'll have a tutor come to the hospital an hour a day so you get some school in. I think if a parent said, or a kid said, like, I cannot do that because I have the biggest football game of my life coming up in 2 weeks. Parents would not say, oh, that's right. Like, we don't want to get in the way. Like, this is such an important thing for you, right? Or prom, I have to go to prom. I can't get that surgery. But when we talk about depression, when we talk about addiction, when we talk about anorexia or bulimia, oftentimes the sense of urgency around prioritizing health, the medical implications of a lot of these psychiatric illnesses are undervalued, disavowed, and what's prioritized is normalcy. Everybody wants to be normal and do the normal things, right? So I can fully appreciate, both as a parent and as a person seeking treatment, the strong, overwhelming pull to just do normal and to have a sense of normalcy, especially if something's going on inside that is scary, that you don't understand, that you don't have control over, that you need help with. And that ends up setting people back, sometimes to the point where instead of needing 3 times a week intensive outpatient treatment in the evenings, they end up needing an inpatient hospitalization, followed by a residential, followed by, a month of full day treatment, and then back to intensive outpatient or outpatient. I also tell people, especially young people looking to go to college or, get that 5.0 on a 4.0 scale and get into Yale or Dartmouth or Harvard, your college experience will be completely altered by an active mental illness, by an active eating disorder, by an active addiction. And the trajectory of your life with treatment changes. The earlier we can affect that change and put that illness to a state of arrest or cure, the better the rest of your life will be. And that has profound implications, especially to teens whose brains are still developing.